Hello, everybody. Good afternoon. Thank you so much for being here with us today for today's session with the Ministry of Long-Term Care Fall Respiratory Season Preparedness Fireside Chat. My name is Taeyang Zhang, and I am the Bilingual Events Manager at Family Councils Ontario. Before we start, I would like to take a moment to recognize the land on which we are gathered today. I am currently in Toronto, which is seated on the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis people. We also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. Just a few logistics and housekeeping rules before we turn things over to our guest speakers. Um, so you can use the Q&A box throughout the session today to ask your questions. There will be reserved time at the end for an interactive Q&A period. So you can ask your questions throughout the presentation and we'll get to it at the end. And we encourage you to be very engaged and ask all the questions. And you can also use the chat feature throughout the presentation to communicate within ourselves, among ourselves. And if you have any like technical or logistic questions for me, you can also leave that in the chat box and I will be monitoring it throughout the presentation. And you'll notice that the session right now is being recorded. So FCO, we try to record all of our sessions for those who may not be able to be present today. And if you want to revisit this session later on, it will be on Family Councils Ontario YouTube channel next week. So without further ado, I will like to pass the mic to Sandra, Assistant Deputy Minister. Let me just unpin myself and here we
Thank
go.
you. Thank you, Taeyang. And good afternoon, everyone. Welcome to this year's 2025 Respiratory Illness Season Preparedness Fireside Chat. As Taeyang said, my name's Sandra, and I'm the new Assistant Deputy Minister in the Ministry of Long-Term Care's Operation Division. We're really, really pleased to be partnering with you, the Family Councils of Ontario, on today's session, alongside the Office of the Chief Medical Officer of Health. As we head into the fall and winter months, this chat is an opportunity to come together to share timely updates, what to expect for the season ahead, and important information for residents and families on upcoming vaccinations. We know that respiratory viruses like COVID-19, influenza, and RSV continue to pose challenges for our residents, staff, and care partners. And I can appreciate how committed families are to helping to keep our long-term care residents healthy. Infection prevention and control is a shared responsibility, and I want to thank you all for being a part of that and for doing your part to keep your loved ones and our residents safe and staff. So I also want to say a special thank you to Dr. Mary Choi and Associate Medical Officer of Health, Dr. Daniel Warshawski from the Office of the Chief Medical Officer of Health, who are helping us with today's session. We look forward to a really great discussion with all of you, and I'm really happy to be here. Over to our first presenter.
Thank you so much for the kind introduction, Sandra. As Sandra mentioned, my name is Dr. Mary Choi. I'm the Senior Medical Consultant with the Office of the Chief Medical Officer of Health. I have the privilege of working with my wonderful colleagues from Ministry of Long-Term Care, as well as my colleague, Dr. Daniel Warshawski, who's here. I oversee the respiratory season outbreak preparedness and response, really working closely with public health units as my sector. And so the Ministry of Long-Term Care colleagues asked me to come and chat with you about some of the things that we're seeing, as well as any tips that we might have for you as we head into the respiratory season for this year. Next slide, please. So this is something that I like to start my slide deck, my presentation with, even though obviously we all know what it feels like to have the common cold or the flu. It's awful, it's miserable, and we know that it's associated with some very specific symptoms that we're all very familiar with, like fever, chills, coughing, shortness of breath. I put this list up, however, just as a reminder, because this is a thing that we will come to again and again throughout the season, especially for your loved ones in long-term care homes, as this is the symptom list that the homes will be screening the residents for, just to make sure that they're still healthy and they're not presenting with these symptoms. And if they do present with one of these symptoms, this is what will eventually trigger the additional testing and the potential treatment thereafter. So just to be able to ground us all so that we are speaking the same language, the list is here for all of our collective awareness. And as I mentioned, now that we are heading into the fall and winter months, we will be starting to see more respiratory viruses like influenza, RSV, COVID-19 to be circulating more and more so in our community. One of the things that we think about when we think about fall and winter, especially here in Ontario, is that as the weather gets colder, the temperatures are dropping, we tend to spend more time indoors. And as we spend more time indoors and socialize more in close proximity, this is really when those viruses are able to really take hold and start spreading. And it's not that as well as we all remember from the pandemic days, it's the same principles. It's the talking, the sneezing, the coughing in that close proximity that will really result in you getting sick, courtesy of a loved one who also has been infected. Next slide, please. One of the things that we are used to that we lost during the pandemic is that, every fall and winter, we could really predictably expect to see the rise of the return of the common cold and the flu, and for everybody to get sick. And then as the weather warms up, the virus circulation and the rate of illnesses tend to go down. During the COVID-19 pandemic, especially in the first couple of years when there were public health measures in place, what we saw was that those measures worked really well, not only for COVID-19, but for other respiratory viruses like the influenza and RSV as well. And so we actually saw very little of other respiratory viruses in those first few years. And then as we started gradually returning back to our day-to-day activities and back into our societal mode, what we ended up seeing was this return of the influenza, RSV, and other viruses alongside COVID-19. Now that we have a few years under our belt, what we're starting to see is that the common respiratory viruses like the influenzas and the RSVs are starting to settle back into that predictable seasonal pattern, which is really helpful for us, both in public health as well as in the health system, because it gives us that predictable cycle with which, that gives us time to be able to prepare so that we are best equipped to be able to deal with the rise in number of patients and illnesses, which we didn't have during the pandemic. So that's one thing. So this is one of the patterns that we're seeing and noticing in public health. And then the other thing that we're seeing is COVID-19 COVID-19 was still that new kid on the block. We couldn't really predict when the cases counts would rise, because up until now, it's really been determined and dictated by the emergence of a new dominant strain. So as one of the viruses take hold in terms of circulation, that's really when we saw a lot of cases develop, and then things will quiet down until another dominant strain would emerge. Again, with COVID-19, now that we have a few seasons under our belt, it's starting to settle into more predictable patterns. And so hopefully this will become here on outwards, more again of that fall winter respiratory seasonal activity. These are some graphs that I have lifted from the federal government's website, because I know that some of us myself included, really like to nerd over some of the data and see how the trends have changed. So if this is of interest, it is there for you. Next slide, please. So why do we care so much about the respiratory virus infections in long-term care home settings specifically? We care because, one, we care about our loved ones, and certainly you wouldn't be on this call if you didn't have a loved one who are currently residing in a long-term care home either. The other reasons why we, from public health and health system perspective, care so much as we head into this fall winter respiratory season is because, one, certainly there is that element of medical comorbidities and age-related frailty that does dispose our loved ones at a higher risk for developing severe complications after what would what may be a typical run-of-the-mill cold virus for a younger, healthier person. The other reason why we care is because we accept and we acknowledge that long-term care homes are this incredibly vibrant, dynamic social communities. We want our loved ones to have the best quality of care and be able to see their loved ones, and have, you know, all the joys and the comforts as they settle into their later lives. But that also means that you have a lot of visitors coming in and out of the home on a daily basis. A lot of these people support the operations of the home, but also from an emotional and quality of life perspective, including yourselves as caregivers. It means a lot to our loved ones to be able to see you all. But that also means that as the respiratory viruses begin to spread more so in the community, as you know, as we attend school and we go to our jobs, we become more and more exposed to these respiratory viruses. As these visitors come and go to the homes, it also means that our loved ones are also at risk of becoming sick as well, as humans are going to be the vectors bringing these viruses in. Next slide, please. And so, as Sandra mentioned at the start, everybody has a role to play in terms of infection prevention and control. We all have a role to play in keeping our loved ones in the home and the rest of the community safe. And so a lot of the things will be familiar to you, not just from the pandemic days, but from a very common sense perspective that, you know, the maxims that we grow up with. And those are things like staying up to date with your vaccines every fall and winter respiratory season, washing your hands, covering your mouth and nose, and wearing a mask as much as possible. It's also about, if you as loved ones and caregivers are feeling unwell, letting the home know, and where possible, from a care perspective, so avoiding the home and putting off any visits to see your loved ones when you are feeling unwell, so that again we're able to limit some of the exposure to the viruses for the residents as well. The other things that we're encouraging everybody to do, so certainly if residents are feeling unwell, I was at the resident council meeting yesterday and I encouraged them to notify a staff if they're not feeling very well, and you as caregivers can also flag a staff and let them know that your loved one isn't feeling well. And again, that will spur on some of the follow-up activities that are then important to keep everybody else safe, which may include the implementation of additional measures like again, masking if you're able, staying in your homes, and really limiting some of the unnecessary contact with other individuals who may not be sick yet. Next slide, please. I put this slide in just because I'm from public health, so I do want to make sure that I'm able to share some of the information as to what my colleagues in local public health units do during an outbreak in a long-term care home. So when a resident gets sick or a staff member gets sick, it is what it is. We are sick. That typically means that there's going to be symptoms associated with the illness, like the ones that I mentioned up front at the beginning of my slide deck. However, an outbreak is a slightly different thing that we monitor for, and a respiratory infection outbreak in a long-term care home really means that there are 2 or more residents who develop respiratory symptoms within a short time frame. And why that second part is important is because if there are 2 residents in a home who have never interacted before and they individually have come down with symptoms, it's unlikely that they spread it to one another. But we really get concerned if there is that potential for interaction and potential for spread amongst the residents, again, because the residents are at a higher risk for developing illnesses, and we want to be able to get in there sooner rather than later to be able to stop the further spread within the home and infecting additional residents. What will happen during an outbreak is that the public health units will work closely with the long-term care homes and the staff, as well as yourselves, to take specific actions to prevent additional residents, staff, as well as caregivers like yourselves from getting sick. This also being able to have a handle on the spread of the virus in the home and on the outbreak overall will also help to ensure that the residents continue to receive the high level of care that you're there for, as well as identify and address any infection prevention and control factors that may have contributed to the outbreak. Where the Ministry of Long-Term Care gets involved is that all homes are actually required legislatively to report any suspected or confirmed outbreaks in the home to the Ministry of Long-Term Care. And what that enables us to do is that in the event that there are specific issues that need to be addressed from a broader system level perspective, we're all able to get together, speak the same language, and be able to take action, within our own scope of responsibilities. Next slide, please. So again, bringing it back to like very practical, what is it that each of us specifically can do? So if you are a caregiver or a loved one visiting a resident in a long-term care home, this is what I think are the most important things to keep in mind. So if the resident is feeling sick, here the U is really for the residents. If the resident is feeling sick, please notify a home staff as soon as you're concerned, because what that will then trigger is that the resident can then be assessed by a healthcare professional, get tested, and then potentially, depending on the result of the test, receive medications, which are also listed on the right side of the slide deck. The other things that we're encouraging you and your loved ones to do is to really stay in the home, in their own rooms, and avoid communal activities, again, to be able to prevent further spread of the virus to others within the home. As much as possible, I think the home, I think there are a lot of lessons that we learned during the pandemic about really ensuring and supporting the quality of life for residents. So this will be very much up to individual homes and the circumstances of individual outbreaks, but we are trying to encourage residents to, continue to receive their essential caregivers and to participate where they're able to while trying to protect again the others in the community in the home and preventing further spread therein. And as I mentioned earlier, if you yourself as a visitor or an essential caregiver are unwell, to please let the home know if it's, and as much as possible, again, as care allows, to be able to defer and not visit the home if you're not feeling very well, and wearing a mask if you're able to do so as well. Next slide, please. This is really here for your reference. I know that there are a lot of people that come and go, as I mentioned up front, and a lot of players, especially in an outbreak. So a little bit of a cheat sheet that I put together that hopefully is helpful to you in the event of an outbreak or, before and after an outbreak, so that you can orient yourself as to who you're talking to and who's all involved. Yeah, next slide, please. Oh, that's it. Great. Daniel?
Great. Thanks so much, Mary. Hi, everybody. Daniel Warshawski. I'm one of the Associate Chief Medical Officers of Health in the Ministry, and I'll be talking all about our immunization programs today, which we love. We feel very strongly about them in public health. We're big fans, to the point that Dr. Moore, our Chief Medical Officer of Health annual report this year was all about immunization, the importance of immunization, how we can continue to use immunizations to protect everybody in Ontario. The focus of what we'll talk about today are really the seasonal vaccines. So that's COVID and flu and RSV. But as a reminder, there are lots of routine immunizations that we want to make sure everyone is up to date with, whether that's measles or respiratory season relevant things like the pneumococcal vaccine, which is recommended for everyone over 65, for example, to help protect against pneumonia during respiratory season. So let's go to the next slide. We'll get into the details on specifically some of the COVID and flu pieces to start. So COVID and flu vaccines, they're here, they're in the province now, they're ready to go to access them. So to give the picture, generally what happens is in late September, we finally get those products into the province. It's usually a little bit earlier for COVID the last couple of years. It has been for flu by maybe a week. And that's what happened this year. So the week of September 22nd, we got our flu vaccines into the province. The following we've got, COVID vaccines. The following we got our flu vaccines. And the first thing that happens when they get into the province is we get them as quickly as possible to the highest risk settings, which are hospitals and long-term care homes. For long-term care homes, everybody in the home is recommended to get it. That is residents, that is staff, that is caregivers. All are strongly recommended to receive both the COVID and flu vaccines in that setting because of both, obviously, the risk to individuals residing within the home, being older with medical conditions, as well as the risk of contracting and spreading if it's staff or caregivers or others that are visiting regularly. So that's the strong recommendations that everybody who's going to be in the home regularly should get both their COVID and flu shots every single year. So again, those are available starting right now. They've been available for probably a week or two in most parts of the province, and so really encouraging people to get them. For both of those products, we get a new strain every single year. That's why we have to keep immunizing, because COVID and flu keep mutating. We have to keep covering new versions of it. But we get a new updated vaccine every year that covers the latest version. So that's what we're recommending people to get. For COVID specifically, for just the residents, they're also still recommended to be getting another dose in the spring. That's because for COVID, the immunity, particularly these old adults, we see it wanes very quickly. So while it gives protection for the season, it doesn't last much beyond that. And for COVID, because it isn't quite a seasonal illness yet, to Mary's point, flu comes pretty much around the same time every year, and then we don't see it over the spring and summer. COVID varies a little bit. We still might see high levels in the spring or even summer sometimes, depending on the variant changes. And so we want to make sure there's year-round protection for those highest risk individuals. At that second dose, though, again, we're not recommending that for the caregivers or staff, because they'll still have that good immune response that will last them through until the next season. The other thing to note for COVID vaccines is slight change for this year is the only thing we're recommending now is wait at least 3 months from either the last dose of vaccine or infection before getting the new one. Previously, there were some recommendations saying wait 6 months ideally, but at least 3 months. NACI is no longer giving that recommended 6 months. The fact is we just need to get to that 3-month minimum, and then we see really, really good effect from a new vaccine. Next slide, please. The other one we have that's new for the last few years is our RSV immunization program. So RSV is the third big one that we have in the respiratory season. It's COVID, flu, RSV that really drive all of our hospitalizations and negative outcomes. We've had a high-risk program for long-term care home residents. This will now be the third year of that in operation. So many long-term care home residents have already been able to get that vaccine. This year, the main change to that program is expanding to community dwelling adults. So even if you don't live in long-term care or retirement home or another congregate setting, anybody who's over 75 can now get it, which is really important, and I'll explain why in a minute. But in terms of this vaccine, it is very, very safe and effective, and it's probably quite a bit more effective than our COVID and flu vaccines. Those, obviously, we know depends a little bit on how well it matches the strain every single year, and there's a bit up and down. But this, for RSV, we don't see those changes in terms of the strain. Hugely protective, like 80% reduction in hospitalization. So it's a really excellent vaccine. There's two different products that we have for that. There's one that's a Arexvy, one a Brisvo. They're equivalent per our National Advisory Committee Immunization. Whichever one is most readily available is really the one to be getting. The other important note about our RSV vaccine is that it lasts multiple years. So while I'm talking about it today as a seasonal vaccine, it doesn't actually need to be given seasonally. It happens to be that this year, the program expansion is happening around the time of the season, and that we certainly give an extra push at this time of the year just to make sure, because it's when we see RSV. But we know that it lasts at least 4 years in terms of protection, and probably more. We just haven't had the vaccine around long enough to know exactly how long it's going to last. But certainly for anybody who would have already received an RSV vaccine in the last couple of years when we had the program, they don't need another one this year. The other thing I want to note about RSV is last year we had a really bad year for RSV hospitalizations. So higher than any in the last probably 10 years in terms of how many hospitalizations for RSV. That was particularly in older adults. So normally we see about the same amount in in infants and in old adults. Those are the two populations at risk. We saw a relatively mild year for infants, but hugely affecting older adults. But the thing I want to note is that was particularly community dwelling adults. When we looked at long-term care homes, we actually saw a decrease from the previous year in terms of outbreaks and cases. So I think just like we saw live, like real time, how effective our immunization programs were, which is even though it was a terrible year for most older adults, for those living in long-term care with the access to the immunizations, it was even better than previous seasons. So I think, again, just demonstrating how well this really works. Next slide, please. So this is a question we get all the time, so I want to cover it here for everybody. All of these immunizations can be given at the same time if that is most convenient. It is absolutely safe to do so, whether it's COVID and flu and RSV, or adding your pneumococcal vaccine in there as well, or whatever else it is, they can all be given at the same time. We do not see any safety concerns with giving at the same time. We do not see any issues with how effective they are given at the same time. It's just as effective and just as safe. The only thing we might see is your arm might be a little more sore because you may have gotten 2 vaccines in instead of 1, but that's really it in terms of side effects from getting multiple. So again, you can give all these at the same time, and generally that does help to increase the uptake. So we encourage that to be done in most settings. We know in a lot of long-term care homes, they'd like to space out the vaccine a little more. I want to say that's safe as well. We just want to make sure the vaccines are given before the season starts. That's the important thing, because it takes about 2 weeks to develop that protection. So right now we're doing very well for all COVID, flu, and RSV are all in low levels. In the next few weeks, we'll probably start to see them continue to increase. And by November is when we really are usually well within our flu and RSV season. So we just want to make sure everyone at least has lots of time before that we have those vaccines in. If that means co-administering, great, please do so. If there is the luxury of spacing it out because of time, that's fine too, but making sure we get them before we get into the season. Next slide, please. So key messages for today, and summarizing both what Mary said, what I said, and then we have lots of time for questions. Respiratory infections are extremely common in the respiratory season. That's why we call it that season. But essentially fall, winter, when people are indoors more often and associating much more closely with each other, we see things spread. But there are a lot of things we can do to keep ourselves and others safe. We've talked about them all today, many of them today, but basics like staying home when you're sick, like getting your immunizations in time before the season, like wearing a mask, indoors, particularly in places like long-term care homes or other high-risk settings when we're in the respiratory season, like ensuring that you're washing your hands regularly. All of these things really do make a very big difference. And I want to extra emphasize the non-immunization things for a minute, because yes, we all have immunizations and they're great, but there are a whole host of viruses that we don't have immunizations for, and all those other measures still work really, really well to protect against them, whether it's your masking and your hand hygiene and staying home when you're sick. So that's really the number one thing for all of us to do. But definitely staying up to date with your immunizations. It is very, very safe and extremely effective at reducing particularly those severe outcomes. So that's all residents, caregivers, staff, everyone in the home should really be getting their vaccines, getting them in advance of the season, making sure we have that protection available so we don't see additional spread of these viruses within our homes within the respiratory season. So I think that's it from me and Mary, and happy to go to questions, Julia.
Thank you both, Daniel and Mary, for giving us that rundown. Right now, we only have one question in chat, so if anybody else has any questions, feel free to go ahead and pop those in. The first question I think is for you, Daniel. Are 3 vaccines at the same time okay? COVID, influenza, and RSV?
Yes, absolutely. So I mean, like same, we give our infants 3 to 4 to 5 vaccines sometimes in a single visit. And someone was telling me, like, if we're comfortable doing that, why not for older adults? And the answer is we are. We absolutely are. It's totally fine to give 3 vaccines in the same visit. The only restricting factor is having enough places on someone's body to be able to give the needle safely and effectively. But 3 vaccines is not a problem. You can give multiple in one arm if you have to, although again, if we're starting with 2, we want to do opposite arms just to reduce the slight risk of having more sore arm afterwards. But they are just as safe if we're talking about more severe outcomes, and just as effective getting them all at the same time.
Perfect, thank you. I'm not seeing any other questions yet. We'll give it a couple minutes, see if anybody has anything that they've been itching to ask.
Sorry, one thing that I wanted to emphasize that I forgot, because I think we took the slide out for time. For flu vaccines, there are 2 different types. There's our standard dose flu vaccine, that's for everybody, and there's what we call enhanced products. So there's 2 different of those. There's an adjuvanted vaccine or a high dose vaccine. I think the high dose is one a lot of people know from ads and the media. Those 2 enhanced products are the ones we recommend for older adults, anyone over 65, anyone living in long-term care, because they are more effective at preventing those severe outcomes. So the other piece, if we're talking about flu, just yes, everybody should get their standard dose. We should all be getting our flu vaccine, but for any resident of long-term care, anyone who's higher risk, please ensure that you're getting one of those enhanced products. Doesn't matter which one, they work equally as well, but they're both better than the standard dose.
Awesome, thank you. We have one more question. Where does one get N95 masks? I think this is more general public wise, I'm assuming, but Joyce, let me know if that is incorrect.
So
Let's ask for general public. Oh, hi, thanks, Mary.
So N95 masks are available to purchase. I think it really does, unfortunately, depend store to store. What you will more commonly see, though, in places like your local pharmacy, etc., will be the KN95s. The tricky thing about the N95s is that they are really intended to be industrial or occupational grade. And they do require a very specific fit testing that's often done by occupational health staff to make sure that you have an N95 mask that's actually fitting, as the name suggests, fits your face and your facial bone structure appropriately to, again, be able to create that really good seal to prevent airborne exposures from getting in. So what really, but that being said, a surgical mask is fine. The N95 masks, if you are able to do it, please make sure that you are getting fit tested. Otherwise, the KN95 masks that you will see in stores are fine as well.
Thanks, Mary. I think this question is directed to Daniel. To clarify, RSV is given every 2 years, correct?
So not every 2 years. It lasts at least 4 years between doses, and probably more. We're just waiting to see how long it will last. So for right now, anyone in Ontario who's received an RSV vaccine does not need to get another one. We know it's lasts longer than the program has been in existence so far. So it may be 5 years, it may be longer. We don't know for sure, but at least 4 years between doses at this point.
Amazing, thanks. Another question we have, are rapid tests available?
Yes, so long-term care homes are eligible to continue to receive publicly funded rapid antigen tests for use really for the residents as part of their patient care. We do encourage the use of rapid antigen tests for residents because, as we all know, the rapid antigen test will give you the test results within 15 minutes, as opposed to a traditional lab-based test that require a few-day turnaround time, and because it needs to go to the hospital or the community labs to process. Couple caveats for the rapid antigen test. The only ones that we do have right now are COVID-19 based. So if you are looking for other viruses, because again, COVID-19 isn't the only virus that's circulating this year, if you want to make sure that the residents have something, if you want to provide a more of a general test to see what they have, you will need to actually send off a laboratory-based test if eligible, as well as doing the rapid antigen tests. Doing the lab test is important because we do have antiviral medication treatment for influenza as well. So if they do test positive for flu or COVID-19, there are antiviral medications available. And so sooner you test, the sooner you're able to get the medications. And the medications work in such a way that it really is most effective if you take it as soon as your symptoms develop. For caregivers and others in the community, I think the rapid antigen tests are still available to purchase. Okay, Daniel is nodding, so
They're in
you
pharmacy
are able to
still, yeah.
purchase. Yeah.
Actually, this kind of leads us into our next question. Someone is
Yeah.
asking, where can one get COVID tests? Many of our pharmacies do not carry them.
Ooh, if the pharmacies should be the ones that are carrying them. Daniel?
Yeah, so it would only be through pharmacy if you're looking to get them, if you're not in one of these higher risk settings like a long-term care home or other place. What I want to emphasize though is if you're not someone who's eligible for treatment, it really doesn't matter if you have COVID or something else. And I really want to stress that point. As we talked about at the beginning, there are multiple respiratory viruses that circulate this time of year. Only one of them comes up on the COVID test. If you're sick, you're going to have a different one of them, even if that test was negative. So it really doesn't matter if you have COVID or flu or RSV or pneumovirus or whatever it is. If you're sick, you should stay home and do all those other measures we talked about. The only time it matters is, to Mary's point, when we have specific treatment for what it is, which means flu and COVID. Those are the only ones we have specific antiviral treatment for. So only in those settings where treatment makes a difference do we even recommend people test. Otherwise, it doesn't matter. Save your time and money, frankly. from trying to find the tests, and just stay home and do all those other measures.
Awesome. Thank you, Daniel. Is there any cost for vaccines 65 and under? I'm assuming this is referencing RSV because of the call it to 65.
Yeah, I'll run through the big. So for COVID and flu, no, they're covered for everybody in the province. For RSV, it's only for the high-risk groups and people over 75. So the high-risk groups include all long-term care home residents, retirement home residents, other congregate settings, as well as a number of high-risk medical conditions like cancer patients or transplant patients or dialysis patients. Outside of those high-risk groups, though, if you're under 75 and want an RSV vaccine, that would be paying out of pocket for it. So they're authorized for use in individuals over 60. So you can talk to your doctor about it, whether it makes sense for you to get it if you're not in one of those high risk groups and not over 75.
Awesome, thanks. Our next question is, what type of hand sanitizer should family members be using?
So what we normally recommend is anywhere from 70 to 85% alcohol content is what is considered healthcare grade. And one that is not expired, because that is very important. We had a lot of people using expired hand sanitizers and other disinfectant products at some points during the pandemic. And that's really it.
I will just emphasize that soap and water is still preferred.
Also very good.
So yes, hand sanitizers are great. If that's what you have, please use them. But if you have the ability to wash your hands with soap and water, that is still the best.
Yeah.
So please do that as your number one choice. But if you want to take a Purell with you, that's always good too.
That's a good reminder. I'm not seeing any other questions yet in the chat. Oh, one just popped up as I was saying that. Residents in long-term care homes, are they still, hold on, every 4 years for the RSV vaccine? So I think we kind of already touched on that we're not sure as of yet how long it's going to last, but everybody's okay as of right now.
Yeah,
Daniel,
absolutely. So again, that's regardless of long-term care home resident, community dwelling. So the studies have been done in those high-risk groups, which are people living in long-term care and people over 65 in the community. In all of those groups, we still see really good effectiveness out to 4 years right now with the vaccines that we have. So, there's 2 currently available on the market. There's another one that's, I think, a year behind. So that one has 3 years, but they're all looking the same in terms of effectiveness. And yes, at least 4 years of protection is what we see.
Awesome. Another question about the RSV vaccine. What is the frequency of receiving the RSV vaccine? Is it yearly?
1 time so far, and then we'll let you know if you ever need another one.
All right, I'm not seeing any new questions right now. I'll give it another minute in case anybody's typing. Not seeing anything yet.
I just wanted to jump in quickly. I was trying to put my hand up, but I couldn't figure out how to do it. And good afternoon, everyone. I just wanted to clarify really quickly. I understand that the questions being asked are really more for family members, but I just wanted to clarify, in case this is a discussion that comes up when you're in the home, that personal protective equipment continues to be available for long-term care homes through the Supply Ontario portal. As well, there are fit testing services available for personnel provided through the portal as well. So I just wanted to make that distinction. Thank you. And I'm Jackie, by the way. I'm from the Ministry of Long-Term Care. I should have introduced myself. Thanks, everyone.
All right, thank you, Jackie.
Thank you, Jackie. That's really important clarification, especially for those of you who are asking about N95. So that's very helpful. And I guess just one other thing that I would note is, as caregivers, obviously you have a very you play a huge role in your homes in the lives of your loved ones. And so certainly I encourage you to reach out to your homes and ask them, like, what are the measures and what are the policies that we should be expecting, so that a lot of those outbreak measures aren't a massive surprise to you if they do end up being required in the home to address a specific situation. And during an outbreak, we're encouraging all homes to really actively communicate with all residents and their loved ones and their caregivers. Again, just to keep everybody apprised of the situation, because sometimes things do move very quickly. So just really making sure that that channel of communication is open is really important for everybody's sanity.
Thank you, Mary. We actually have one more question that just came in. It's a bit of a 2-parter. So I'll read the first one, let you guys answer, and then we'll read out the second one. What about the pneumonia vaccine? How often should it be given?
Yeah, great question. So the program is really to cover highest risk kids. So number one, all kids get it when they're growing up. Then there's no doses for a long time unless you have medical conditions. So if you are immunocompromised or have other high-risk conditions, then there will be additional doses, between your childhood years and then 65, and it'll depend on the condition. So, we'll kind of leave that as an aside. You'll talk to your doctor if you have one of those medical conditions. Otherwise, it's everybody over 65 is recommended to receive it. And we have a new, as of last year, like brand new pneumococcal vaccine that covers even more strains of pneumonia. So it's really effective, and we're very excited about having it available. So anyone who turns 65 should be getting that. And then that's one time in terms of getting that new one over 65. So you would have gotten doses as a child, maybe another dose if you have medical conditions before 65, and then one more at 65.
Actually, that kind of leads into the second part of the question.
Okay.
It says, also, I will be 65 in January. Should I get a higher dose of flu vaccine?
Yes. Technically, it's like 65 and older, but like, yeah.
Yes. Awesome. And we have one more question that's popped up in the Q&A. Don't know how technical this is going to be. What ingredients are in the vaccines is the question.
Yeah, really good question. So it obviously depends on the specific vaccine. So vaccines have, whatever fluid they're in that holds the product. It has the actual ingredient of the antigen of the vaccine, which is what your body fights against, which is different in them all. So for our pneumonia vaccines, it's a piece of protein. For your mRNA COVID vaccines, it's the coating for the protein. So it depends on the vaccine. And then it has other things like preservatives and adjuvants. And adjuvants are what promote your immune response. It depends on the vaccine. So if you have an allergy to components, like that's something to look at every individual vaccine to make sure you're not allergic to those components. One we get asked about all the time is eggs and flu vaccine, and it's fine. If you're allergic to eggs, you can still get your flu vaccine. Don't worry. But really, that's probably a question to follow up with your personal healthcare provider about if you have any known allergies or anaphylaxis. If you don't know of any, then the chance of having one to a vaccine is incredibly low because all of those adjuvants, preservatives, the fluids are all found in other things that you would have used, either other medications or many beauty products, frankly, have them that probably someone would have used already. And if you didn't have a reaction, you're not going to have it now to the vaccine.
Awesome. Thank you, Daniel. I'm not seeing any other questions. So maybe we'll give it another 30 seconds or so before we hand it back over to Taeyang for closing remarks, just to see if anything pops up.
One thing I don't know if we emphasized, but in terms of the antiviral medications, because it becomes a question, have a plan. Like talk to your healthcare provider in advance, well before the season. We have lots of time now, but talk to them, figure out if you're high risk. Again, for all of our residents in long-term care, everyone's high risk. Make sure you have like the prescriptions ready to go so that, to Mary's point, like the faster they are started, the better they work. We want it to go like smoothly and as quick as possible. So just a plug, have a plan.
Sounds good. Thank you. All right, I'm going to hand it back over to Taeyang.
Thank you so much, Julia. Thank you, everybody from the ministry team for being present today for this fireside chat, and also to our audience members, family council members, and long-term care staff, long-term care personnel for being here today to discuss about this. If you have any questions, if anything comes up, please feel free to email me. Everybody who is present here today should have my contact, or you can just email events@fco.ngo, and I will pass it along to the ministry team, and we can do the follow-ups. And yeah, so this session has been recorded. It will be on Family Council's Ontario YouTube channel probably next Wednesday. So you can view it again or share it with anybody in your network. And thank you so much once again for being present today. And I hope you have a good rest of the day. Thank you, everybody.
Thanks, everybody. Have a great day.